Well, ever since the big national scandal broke in Phoenix and then elsewhere, there have been some big changes at the VA nationally, and to that end, the VA Secretary Bob McDonald this week is delivering his State of the VA address, and we thought it'd be a good time to check in with the folks at the local VA, the Albany VA, and we're delighted to be joined by the director, Linda Weiss. Linda, how are you?
I'm fine. Good morning, Chuck.
Hey, so you guys, nationally, there was a lot of bad press over the last couple of years, including wait times. What's going on locally and nationally right now?
Well, nationally, the VA has implemented a fair amount of hiring, increased quality standards, funding from Congress to purchase some more care in the community to cover gaps at VA. And to this point, nationally, VA is accomplishing 51.8 million appointments this year, which is an increase of 2.7 million appointments for all the veterans it serves. Locally, the Albany Stratton VA is a national top performer in both access, with 97% of our appointments being accomplished within 30 days. And I'm really pleased to report that we this year passed the Joint Commission on Accreditation of Healthcare Organizations triennial inspection with Gold Seal status for all of our programs.
Why do you think that Albany seems to do so much better than in other parts of the country?
Well, if I had to talk about that, I will tell you there are 1,300 fabulous employees here, dedicated, focused. About a third of them are veterans themselves, who are delivering on the mission for veterans. The quality of our staff, the quality of the medical staff and support staff is absolutely superb.
Speaking to Linda Weiss, director of the Albany VA, you'd mentioned that 97% of appointments within 30 days. I saw some other stats. Average wait time completed primary care appointments 4 days, specialty care 5 days, mental health care 3 days. Are you pleased with those numbers, or can you do better?
I'm incredibly pleased with them. Not being a veteran myself, and at the age where I experienced some of the local private medical care system, our wait times favor incredibly well compared to local medical care, and our access is superb. We also compare highly favorably with our local community partners. If you look at hospitalcompare.org, it has our performance on key medical issues as compared to our local partners, and we fare very, very well in our accomplishment of quality of care in that area.
Do you have an issue? Are some vets reticent to use your services, or even maybe unaware of what you guys provide?
Well, we always look to educate veterans about their benefits. There are some veterans who think if they use the VA, it may deny services for another veteran. That's not true. The more VA veterans who utilize the VA system, the stronger the funding is for the local VA medical center. And at that particular point, we really look to serve all veterans within the sound of my voice and within the area. Getting the word out is always an accomplishment. Word of mouth amongst veterans is great. The VetNet page that WGY hosts for us is absolutely fabulous in educating people about the services we offer here and our access and how to enroll with us.
And what kind of cases are you seeing a lot of now? Hopefully there are far fewer, actual combat-related injuries, but you're seeing a lot of substance abuse issues, PTSD, those sorts of things?
Well, we run the entire broad gamut of healthcare, all the way from cardiac stenting. We take care of a number of women veterans, so OBGYN, although we buy our OB services in the community, we don't have quite as many young women veterans to support that. We do orthopedics. We do long-term care. We do have a phenomenal mental health group treating all sorts of problems and conditions, traumatic brain injuries, concussive disorders. But again, we have a superb gastrointestinal service, really doing a lot of work now with treatment of hepatitis C patients with the new medications that will cure hepatitis C. We have a wonderful oncology program, both with radiation therapy and advanced medical oncology. So, and we just added a new tomosynthesis unit for doing tomographic mammography. So we run the really broad range of medical care services.
Well, they deserve the best. We appreciate the time and keep up the good work. We appreciate it.
Thank you.
Linda Weiss, Director of the Albany VA. Director